Welcome back to another episode of Money and Medicine. If this is the very first time that you are joining our channel today, we hope you find it very useful. Welcome. And please go down to the bottom of this page, hit the like button if you find it useful, as well as subscribe for future content. So today we've got a very, very special guest in the studio today, Debbie van Dijk from Prof Med. Welcome, Debbie. Debbie, tell us a little bit about you. Where are you from? How did you get into the industry? Why Prof Med and why medical aid?
Okay, good morning, Werner. Good morning, Stefan. Thank you for having me today. So I've started working for Prof Med about 7 years ago. I've studied BCom Sports Management, so not where I expected I'm going to be, working in the financial industry. But definitely something that I enjoy. I think working with different people every day in the professional market is something I strive for. Every day there's a new story from a different client. And also definitely working with medical aid, attorneys, the different specialist fields that you get. I'm from Devon. I'm a mom of 3 kids, believe it or not.
Wow.
Yes.
Very blessed.
Blessed, but insane sometimes. But yeah, I'm married to a lovely husband. He's a farmer, so close to nature and enjoying our time out there.
Awesome. Debbie, I want to start off. So one thing about Prof Med, it is a medical scheme that's exclusively available to professionals. But apart from its exclusivity, it's also a traditional medical aid. Can you maybe just start off by explaining to the listeners what's the difference between a traditional medical aid and the difference between a new generation plan?
Okay, so a new generation scheme is where you have different levels of your medical aid, your contribution. So a portion of your contributions will go into your savings, whereas with a traditional scheme, we don't talk about it. We don't have a savings portion, but we have a day-to-day limit. So our day-to-day benefits is set benefits that's making the medical aid of a traditional scheme an uncomplicated and offering more certainty to our members as your benefits is set out. Whereas with the new generation, there's obviously your different levels where there's a self-payment gap and a threshold. So the new generation definitely being a more uncomplicated scheme.
Okay. And Debbie, being very involved with graduate professionals, obviously, and with a specific focus on like the medical professional, what would you say is sort of like the plan that you found a lot of entry level, early in their vocation, early starting out in their occupation? What is the plan that a lot of these professionals opt for? And maybe why? Why would you say that?
Okay, with that, we see a lot of our medical interns, people that's just starting new in the field. We're seeing a lot of the members joining on our Proactive Plus option. The option is booming at this moment, being that it gives you 200% cover of in-hospital cover, and it's giving you a little bit of day-to-day benefits. So working in the professional industry, a lot of our members do have the cash flow available to do an out of day-to-day expense, out of pocket. Whereas they want only cover to have in-hospital, where your big medical bills will be coming from. So we're seeing a lot of our members joining on options hospital plan and maybe going to a Proactive Plus, which is a little bit more than just a hospital plan. So a lot of our members joining on that. Also, the contribution on that, it's a lower contribution that they will get compared to a more comprehensive option. And with that, then obviously they will be saving on contribution, but having the medical aid, the hospital covered in full.
Okay. Debbie, on that note, what is the factors that you have to consider when you look into the different plans at Prof Med? What would you say is the most important health factors for a client to consider?
I think with that it would be client specific. Obviously you'll need to look at the client that you sit in front of. It depends on if there's any chronic conditions, because with our hospital plan we cover 26 chronic conditions, and the higher the plan, the more chronics we obviously cover. Yes. So definitely first looking at the medical needs of the client would be the first factor to look at, and then affordability. I mean, it doesn't help the client can't afford a comprehensive plan. Rather let them have a hospital plan where they've got something than nothing. So definitely affordability versus the medical needs of the client that's sitting in front of you.
Debbie, we've seen a big move in the market where a lot of our clients move, specifically medical professionals, where they move from a traditional day-to-day benefit over into a hospital plan or a hospital option, and then just saving the premium difference per month in a personal savings or wherever they deem fit. So would you say that is a trend in the market currently? Is it something that you would recommend, and why?
Definitely. So with that being said, I think people have started to understand the concept of medical aid, where previously your grandma or grandfather would never just be on a hospital plan. They would say to you, no, how can you just be on a hospital plan? Where things have changed because doctors are not affiliated with medical aids anymore. So you have to stand there with your consultation, paying the doctor out of your own pocket, which it's your credit card or your whatever card, but you need to swipe your bank card first, and then they will tell you to claim back from the medical aid. So you have to have that cash flow available in your pocket anyway. Although you've got a comprehensive plan, you still need to have that medical aid, that benefit in your pocket available. Then also the second one is where people don't realize is although you're on a comprehensive plan, it's still capped. So benefits are still capped. It's not people think that a medical aid is just an open and you can just go wild. No, we will still cap you. So if you want to go for your Oakley spectacles, they will only pay up until a certain amount for that spectacles. They will not pay the spectacles in full. Also with your specialist and your consultation with that. So let's say the specialist consultation is 1,500 Rand. With medical aids, we have a capped rate on specialist. So we will, let's say, pay only 700 of the 1,500 Rand, which leads you, again, makes it out of your pocket again. So you're paying a comprehensive option and still digging in your pocket. So people are moving towards a hospital plan and rather saving that portion in their own pocket, where then they can pay the full Oakley spectacles out of the self-funding that they did on the side.
Debbie, so while we're on this note, have you found perhaps that it do sometimes happen, let's say a patient goes to a doctor, he had a medical option and a doctor charges whatever the medical aid is willing to pay. The doctor will obviously charge that full rate. So let's say that's 1,000 Rand. He will charge the full, or she will charge the full 1,000 Rand. Have you found that when patients sometimes pay cash, that doctors are also a little bit more lenient, a little bit more willing to give them a cash discount because the doctor then doesn't have to go through that whole process? Is that an assumption, or is it something that you found sometimes?
No, that's the truth. It is there that doctors, obviously, they also need cash flow on their side. So again, when you say that you're paying cash, there will definitely be discounts from your doctor. Depending on the doctor, some of them are strict and they say they'll wait for the money. Yeah. But definitely there is doctors out there that would like that cash flow in the practice as well, which will give you then that discount.
So that's a very important tip, to just keep that at the back of your mind. Yeah. So when you go to a doctor, it might be a very expensive specialist. Always ask, will there be a cash discount?
Definitely. Cash? Yes.
Yeah. Debbie, that brings me to the next question. When you opt for these hospital plans to save a little bit on the monthly premium, how would that necessarily affect the benefits such as maternity? Because why I'm asking the question, I've seen it quite often with clients, especially young doctors starting in the industry, doing their internship. They would go for a hospital plan because, like you've mentioned, there's no comorbidities, there's no chronic conditions, they are fairly healthy, but then they start planning a family. And then they go into maternity, and how does that necessarily affect the maternity benefit? And also, what maternity benefits does Prof Med offer?
Okay, so I think where people should realize is you're only pregnant for 9 months. So it's not like it's for the rest of your life. So making that decision on what plan you go, you have to be very careful, because people tend to get blindsided on maternity programs out there and neglect their hospital cover, which will be the big bill of your journey of the pregnancy, will be the in-hospital cover. So people shouldn't get blindsided about a maternity program out there. And then again, it brings me back to what I said previously. On the programs, it's capped. So even though you've got now the maternity program, again, if gynaes in the industry are very expensive, obviously because of the increase in the insurance that they need to pay. So gynaes are extremely expensive, so they will have caps then on that. So again, you have to sit and see I'm paying this comprehensive option to the lead up of the maternity, which, yes, the maternity program will give me the benefit for that. But then once there's always need to know that, let's say baby gets born and baby needs to go to the neonatal ICU. That's an extremely expensive case that one needs to look at. ICU for a baby is very expensive. Now you neglected your hospital cover to have a good maternity program. So people should we first need to make sure that the hospital cover of the client is excellent. And then, yes, we do have a maternity program with Prof Med, but it's only available on our ProSecure Plus, and then the two savvy options of the ProSecure Plus options. Also, it gets paid out of risk, so it won't be coming from your available day-to-day benefits. But yes, I won't say that people will have to go on this option to have the maternity program. You can go on a lower option like our Proactive Plus, which is giving you the 200% cover in hospital, and still have the maternity benefits. So we've got the maternity program that's available on all our options for all our members, expectant mothers, where they will register via our mobile app, and then we will guide them throughout their journey with it, and then they will also receive a special gift from Prof Med for baby.
That's actually something that I wanted to ask is, you mentioned that they have to register on the mobile app. As soon as a client becomes pregnant, a Prof Med client, within what period do they need to inform Prof Med of their pregnancy? And is there a specific timeline that they have to register on that app?
No, so they can register as soon as they heard the good news that they are pregnant. Obviously, we will then just need to have the confirmation. And then, but we also always advise people, because we will be sending out information, to always register after your risk period, because it will be ongoing communication from our side, which will make it a bit for members that maybe had a miscarriage or anything. So always we will advise them to do it after the blood test and everything was done.
Debbie, without rendering advice, but based on factual information, what plan would you say is very suitable, again, for an early career doctor starting out, planning a family within the near future? Is my first question. And then secondly, let's say that option is the proactive or the hospital plan option with a small day-to-day. What is the difference between that maternity benefit and the one that you mentioned that is exclusively on the ProSecure?
Okay, so if they're looking to join on our Proactive or the Proactive Plus, the only benefit for maternity on that would be the in-hospital cover. Okay. So they will only have, once baby, they go into hospital for the C-section or the natural birth, only then will the covers kick in on the Proactive and the Proactive Plus. But also baby gets born onto the scheme. So should there be any complications, baby is covered in full immediately.
Okay. And the ProSecure will then cover all the visits to the gynae,
yes,
etc.
So the ProSecure will give you the NIP test that will be covered. That's now the new blood test that they go for. It will cover consultations leading up to it, one lactation consultation, and then one nutrition consultation, whether it be for mommy or baby. And then also the 6 weeks vaccine that baby gets at 6 weeks, we will do it with a home-based nurse. So they will be doing it from home.
Thanks, Debbie. Then another question that I have is, if affordability is a concern, okay, how can one reduce the premium without necessarily compromising on the benefit?
Okay, so I think with that we also saw the demand for, even though we're working with professionals, we saw the demand in the industry for where people want to save. And that's when Prof Med introduced our Savvy option. So we introduced it in 2019. So it's a network hospital, a network plan on Prof Med. So we still have our 5 premium options, but now the Savvy is just a replica of that. But then you save in contribution, but you then need to make use of a network hospital, which is then any life or any Mediclinic in South Africa.
Debbie, how does that compare to some of Prof Med's competitors in terms of network?
Definitely, I would say we've got the best network in the industry, if you look at our network list, because we also have filler hospitals. So if you look in just in this area, although Mill Park is one of the biggest trauma hospitals, it still forms part of the Savvy network. So we still have filler Netcare hospitals, and then live in Mediclinics, there's a lot of Mediclinics and live hospitals.
Yeah, they've got a big footprint over South Africa. Okay, so what you're saying is it's live, Mediclinic, and then Prof Med handpicked a couple of filler hospitals. These filler hospitals, were they selected on, like, you mentioned Mill Park, obviously one of the biggest, if not the biggest trauma unit in South Africa. So these filler hospitals, was it exactly what it was, like filling the gap? Okay.
So it was also like your Sunning Hill is also a big Netcare, but they are big in cardiology. So we also saw in the industry, we don't want members to go on this but not have any access to that.
So a Prof Med client won't necessarily have to fear if something happens to them, that they will only be limited to a certain hospital in the event of an emergency. They can go to the nearest hospital within this group.
Yes, definitely. So this is only for selective procedures. So if the member decides to voluntarily not use one of our network hospitals on the Savvy, there will be a co-payment of 10,000 Rand. But this is not relating to any unforeseen accidents.
So Debbie, this is actually a question that we get quite often. What is a PMB and what is a late joiner penalty?
Okay, so PMB stands for Prescribed Minimum Benefit. So it's a defined benefit for all members that's on a medical aid, that a medical aid needs to pay the minimum benefit of. Okay, so irrespective of the option that they're on, so whether you're on a hospital plan or the most comprehensive plan on the medical aid, it's the minimum benefit that the medical aid needs to pay for. Okay, then the aim is to provide people with continuous care. So if you're on a comprehensive plan and your day-to-day benefits is depleted, then you still have that PMB cover irrespective of getting diagnosed with a PMB cancer or being in a very bad car accident. You still have peace of mind that your PMB cover is still there.
And that's the same for the hospital plans or the lower plans? That's
exactly. On all the options, the PMB needs to be there. So this is a feature that's according to the Medical Schemes Act. And then it's related to the cost and diagnosis and the treatment of any condition that's a PMB. So that's any emergical condition. It's then also a set list of 270 non-chronic diseases or conditions, and then your 26 chronic conditions on all the options. That's your chronic disease list. So that forms the part of the CDL.
Okay. And a late joiner penalty?
A late joiner penalty is only applicable after the age of 35. So this is a penalty that members will be paying if they have not been on a medical aid previously. So it's obviously got different categories. So let's say you are now 40 years old and you haven't been on a medical aid. So we take the 40 years, we minus the 35, as we will only impose it after the age of 35, which gives us 5 years. And then it would depend on the category. So there's a 5% late joiner penalty that is relevant to that person's specific contribution. So it won't be on the overall contribution. It will only be to that specific member's contribution. And then it can go up to 75%.
Okay. Debbie, a last question from our side, and this should be sort of like just your elevator pitch, if I can call it that. Why Prof Med?
Okay, yes. So I think Prof Med is like the Rolls Royce if you look at medical aids. I mean, it's an exclusive medical aid for only graduate professionals. It makes the risk working with having the medical aid of only graduate professionals, it makes the risk pool very healthy. And the healthier the risk pool, obviously, the lower we can look at increases at the end of the year. Another thing is there's no co-payments once you get admitted with Prof Med. So once you get admitted in hospital with Prof Med, there won't be any co-payments in hospital.
Wow, that's nice, yeah.
So that's a big thing to look at.
Does that include scans?
Scans, yes. So you've got MRI scans, CT scans, and your PET scans in hospital will not have any co-payments on it.
Okay. Demi, I know Prof Med is also part of the PPS group. Will a member share in the profit share scheme if the member has Prof Med or is a member of Prof Med?
That's one of the reasons why Prof Med is already, if you're a Prof Med member, you qualify for PPS. So being a PPS member as well as a Prof Med member, it will also contribute to your profit share on PPS side.
Okay. Well, Debbie, thank you so much. It was very insightful. Thank you for sharing and for availing yourself today. We truly appreciate it, and thanks for coming into the studio. We want to also thank our listeners and those of you watching the video channel. If this is the very first time that you are watching the channel, please go down to the bottom of this page, hit the like button if you found it useful. You're also welcome to leave some comments, and we will get back to you as soon as possible. Until next time, plan the plan.